Good day, everyone. Welcome to Nloa 1 Long Test for Rationalization. I'm actually in charge of discussing 25 items, and of course, I'm actually talking about the first one, which is care of adults in clients, care of other clients in pain. Let's begin with the first 12 questions. Number one, a client with chronic pain reports to the in charge nurse that other nurses have not been responding to requests for pain medication. What is a charge nurse's initial action? A. Check the medication administration record for the past several days. Letter B. Ask the nurse educator to provide in service training about pain management. Letter C. Perform a complete pain assessment on the client and take a pain history. Or letter D. Have a conference with the staff nurses to assess their care of this client. Of course, when we talk about uh, nurse's role, you are the charge nurse here. You are not the medication nurse. So the first step of this is basically on the nursing process. And in this case, the charge nurse applies the nursing process to assess the nursing staff's performance and at the same time the attitude. So when we talked about letter C, that's the responsibility of the staff nurse, specifically the medication nurse, because you're performing a complete pain assessment on the client and take a pain history. That's part of the staff nurse's role. So eliminate natin yung letter C. And then we will also have to eliminate letter B. Ask the nurse educator to provide in-service training about pain management because this is also part of the management process, but this is already on the implementation phase. So that is basically on the directing phase because you are already providing a training for the nurse educator. And then of course letter A, check the medication and administration records for the past several days. That is actually part of the assessment, but that is not going to focus on those staff nurses role, specifically the medication nurse. So the best answer for number one is letter D, have a conference with the staff nurses to assess their care of this client. And of course, the charge nurse must have to assess the performance and attitude of the staff in relation to this client. After data are gathered from the nurses, additional information can be obtained from the records and the client as necessary. And the educator may be of assistance if a knowledge deficit or need for performance improvement is the problem. And our focus this time is basically on prioritization and at the same time on supervision. Answer for number one, letter D. Number two, the home health nurse is interviewing an older client with a history of mild heart attack failure and rheumatoid arthritis. The client reports feeling pretty good, except for the pain and stiffness in my joints when I first get out of bed. Which member of the healthcare team would be the most appropriate to aid in a client's report of pain? A. Healthcare provider to review the dosage and frequency of pain medication. B. Physical therapist for evaluation of function and possible exercise therapy. Letter C, social worker to locate community resources for complementary therapy. Or letter D, unlicensed assistive personnel to help client with a warm shower in the morning. Of course, in this question, we talk about delegation. So when we talk about delegation, then we are not talking about the healthcare provider. You're not supposed to delegate tasks with them, and also not the physical therapist and not also the social worker. So the answer for number two is letter D. Our nursing assistant or the unlicensed assisted personnel is actually one that is needed to assist with warm shower. So the answer for number two is letter D. So one of the most common features of rheumatoid arthritis is basically on joint pain and stiffness when first rising. This usual this usually resolves over the course of the day, and a non-pharmacological measures is to take a warm shower, basic or have a warm packs to the joints if pain is limited to one or two joints. And then if pain worsens, then the nurse may elect to contact other members of the healthcare team for additional interventions. As what I mentioned, this is focused on delegation. So the best answer for number two is letter D. Number three, a client with diabetic neuropathy reports a burning electrical type pain in lower extremities that is worst at night and not responding to nonsteroidal anti-inflammatory drugs. Which medication would the nurse advocate for first? A. Gabapentin. B is corticosteroid. Letter C is hydromorphone. And letter D is lorazepam. Eliminate na kagad yung letter D because lorazepam is basically a an anxiolytic drug. And then eliminate din natin itong letter B because corticosteroids are uh, directed for pain that is related to inflammation. So we're down with letter A and letter C, and we know hydromorphone is actually a stronger opioid, and it is not the first choice for patients having chronic pain, which can be managed by other forms of medication. So the best answer for number three is letter A, gabapentin. That is an anti-epileptic drug, but that's also used to treat diabetic neuropathy. So number three is letter A. Four. The nurse is caring for a postoperative client who reports pain. Based on recent evidence-based guidelines, which approach would be best? A. Multimodal strategies. B. Standing orders by protocol. Letter C. Intravenous patient control analgesia. Letter C. Opioid dosage based on valid numerical scale. Of course, here you are talking about post-operative clients who actually reports for pain. So therefore, it's very important for us to have uh, an approach that is multifactorial in nature. So we cannot immediately start with your PCA, and also we cannot start immediately with opioid because that is dependent on the need of the patient. So the best answer for number four is letter A. So these multimodal therapies for post-operative clients include opioids and non-opioid therapies. It also includes regional anesthetic techniques and pharmacological therapy. So this approach is thought to be the most important strategy for pain management for most post-operative clients. So we have already eliminated standing orders because these are less optimal and there's no consideration of individual needs or basically characteristics of the patient. And at the same time, your patient control anesthesia is an important element, but not all clients can actually manage PCA. So therefore, it should have to be case-to-case basis. And of course, our assessment tools are an important part of overall management, but basing up your dose on numerical scale does not consider individual client circumstances because it's actually highly subjective. Therefore, we need to acknowledge whatever pain the patient feels. So number four is letter A. Five. The nurse is considering seeking clarification for several prescriptions of pain medication. Which client circumstance is the priority concern? A. 35-year-old opioid naive adult with a basal dose of morphine via IV patient controlled analgesia, or a 65-year-old adult with this they will be discharged with a prescription for non-steroidal anti-inflammatory drugs. Letter C, a 25-year-old adult is prescribed as needed intramuscular analgesic for pain. Or letter D, a 45-year-old adult is taking oral fluids and foods, has orders for IV morphine. Of course, in this case, we are taking into consideration priority concern for which of this client. We are going to be focusing on prioritization. So, of course, it's very important for us to study the purpose, of course, the medications, pharmacologic actions, and its side effects, especially for the commonly used medication. We know that morphine is considered the prototype of opioid medications, and for naive clients, the priority concern is basically on respiratory depression. So, for clients who need opioids for long term pain management, the primary side effect of that is usually going to be for constipation. Thus, we might actually talk about giving this patient fluids. So, of course, in this case, it's not our priority, but our priority is basically on an individual who has greater risk of possible respiratory depression. So, the best answer for number five is letter A. The nurse would actually consider questioning all the medication prescriptions, but the opioid naive adult has the greatest immediate risk because of a basal dose that has been associated with an increased incidence of respiratory depression in an opioid naive clients. So older adults are frequently prescribed NSAIDs. However, they are used with caution, and the client's history should be reviewed for potential problems such as history of gastrointestinal bleeding, because of course we know that NSAIDs can cause GI upset, cardiac disease, or renal dysfunction. And many medications such as anticoagulants, including oral hypoglycemic agents, diuretics, and antihypertensives can also cause adverse drug-drug interactions with NSAIDs. And when we think about IM injections, it can cause actually pain and the absorption is unreliable, and there are no other advantage over other routes of administration. So if a client is stable to tolerating oral fluids and oral medications are preferred because the efficacy of the oral route is equal to the IV route. So number five, the best answer is letter A. Six, a client is crying and grimacing, but denies pain and refuses pain medication because my brother is a drug addict and has ruined our lives. What is the priority intervention for this client? A. Encourage expression of fears and past experiences. B. Provide accurate information about the use of pain medication. C. Explain that addiction is unlikely among acute care clients. And letter D. Seek family assistance in resolving this problem. Of course, that is psychological in nature. Therefore, we need to answer it psychologically. So the best answer for number six is letter A. Because this client has a strong belief and emotions related to the issue of brother's addiction. So that is our priority. We need to first encourage expression of feelings. So that indicates to the client that the feelings are real and valid. And it is also an opportunity to assess possible beliefs and fears about drug addiction. When we are giving facts and, of course, vital information, that's considered to be appropriate at the right time. And family involvement is important, and the beliefs about drug addiction may be similar to those of the client. And of course, our focus this time is related to prioritization. Number six is letter A. Dapat letter A siya. Hindi po siya letter D. Okay? So it should have to be letter A. It should not be letter D. Sorry, typo error. Number seven. The healthcare provider has ordered a placebo for a client with chronic pain. The newly hired nurse feels very uncomfortable administering medication. What is the first action that the new nurse should take? A. Prepare the medication and hand it to the healthcare provider. Letter B. Check the hospital's policy regarding the use of placebo. Letter C. Follow a plus personal code of ethics and refuse to administer. Or letter D. Contact the charge nurse for advice and suggestions. Of course, when you talk about placebo, it is actually for patients who are chronic already in pain. So when we talk about that, it is basically on the protocol of the institution. So that has to be case to case basis. And of course, since you are a new nurse, you have to be familiar on what is the practice of the institution. Therefore, the best answer is letter D. Contact the charge nurse for advice and suggestions because it is considered to be unethical in nature, and we're trying to have it a form of research because that is placebos are used. And of course, the charge nurse is a resource person who can help clarify the situation and possibly locate and review the hospital policy. And if the healthcare provider is insistent, suggest that he or she could give the placebo. Note, could not should when talking to the healthcare provider. So this is actually going to provide a small opportunity to rethink the decision and should elicit a more defensive response. Allowing Following a personal ethical code is correct when the nurse must ensure that the client is not abandoned and that care continues. So the best answer for number seven is letter D. Eight. On the first day of surgery, a client receiving analgesic via a patient control anesthesia pump reports that the pain control is inadequate. What is the first action that the nurse should take? A. Deliver the bolus dose per standing order. Contact the healthcare provider to increase the dose, try non-pharmacologic comfort measures, or assess the pain for location, quality, and intensity. Of course, what is asked here is first. Therefore, you should answer it with an assessment. Answer for number eight is letter D. So, assessment or assess the pain for changes in location, quality, and intensity, as well as the changes in response to the medication, and that will actually going to guide you what's the next treatment. So you may observe nurses giving pain medication without performing an adequate pain assessment. That's considered to be an error in clinical performance. And in post-operative clients, pain could signal complications such as possible hemorrhage, or there's presence of infection, or there's a decrease in perfusion that is related to tissue swelling. Always assess pain first, then make a decision about giving medication that is using non-pharmacologic methods or contacting the healthcare provider. Number eight, D. 9. Families A client's family member comes to the nurse's station and says he needs more medicine. He's still having a lot of pain. What is the nurse's best response? A. The healthcare provider order the medicine to be given every 4 hours. Letter B. If medication is given too frequently, there are ill effects. Letter C. Please tell him that I will be right back to check on him. Letter D. Let's wait about 40 minutes. If there he still hurts, I'll call the healthcare provider. So of course there are two words used here together. As that's letter A and D uses healthcare provider. That's gonna be eliminated because if there will be two options having those terms, that is avoiding the answer of the family member. So we're left with letter B and C. So of course, when we talk about that, there has to be prior assessment. So that's responding to the client and family in a timely fashion is considered to be important. And of course, you directly ask the client about the pain and perform a complete pain assessment that is PQRST. And then the information will determine which action to take next. Then the focus here is basically on prioritization. Number 9 is letter C. 10. Pain disorder and depression have been diagnosed for a client. He reports chronic low back pain and states none of these doctors have done anything to help, which client statement is caused for greatest concern. A. I twisted my back last night and now the pain is a lot worse. Letter B. I'm so tired of this pain. I think I'm going to find a way to end it. Letter C. Occasionally I buy painkillers from a guy in my neighborhood. Letter D. I'm going to sue you and the doctor. You aren't doing anything for me. Of course, our focus here is basically on prioritization. So that's greatest concern that might actually going to cause harm of self and at the same time harm of others. So if you're talking about letter D, then the client can always threaten to sue, but that the nurse must remain calm and continue to care with professional courtesy. And if you're talking about substance abuse, that's basically high and should eventually be addressed. But if you talk about the best answer for number 10 is letter B because that's going to be a form of suicide threat. And the clients with pain disorder and depression have a higher risk for suicide. And of course, new injuries must be evaluated, but this type of pain reports is not uncommon for clients with pain disorder. Number 10 is letter B. 11. The nurse is caring for a young man with a history of substance abuse who had exploratory abdominal surgery 11 days ago for a knife wound. There is a prescription to discontinue the morphine via patient-controlled analgesia and to start oral pain medication. The client begs, please don't stop the morphine. My pain is really a lot of worse today than it was yesterday. What's the best response by the nurse? A. Let me stop the pump and we can try oral pain medication to see if it relieves the pain. Letter B. I realize that you are scared of the pain, but we must try to wean you off the pump. Letter C, show me where the pain is and describe how it feels compared with yesterday. Letter C, let's take your vital signs and I will discuss your concerns with the healthcare provider. Our focus here is basically on prioritization. So again, we focused on assessment first. The best answer is letter C. So that's assessing the pain is the priority in this acute care setting because, of course, there's an increased risk of possible infection or hemorrhage. And the other options might be appropriate that is actually based on what has been assessed. 11. Letter C. 12. The nurse recognizes that there are ethical considerations in helping clients to achieve pain relief from pain, which nursing action is the best example of the principle of non-maleficence. The client seems excessively sedated but continues to ask for morphine, so the nurse conducts further assessment and seeks alternative to opioid medication. The letter B, the client have no disease or disorders and no objective signs of poor health or injury, but reports severe pain, so nurse advocates for pain medicine. Letter C, the client is older but he is mentally alert and demonstrates good judgment, so the nurse encourages the client to verbalize personal goals for pain management. Letter D, clients repeatedly refuse pain medication but shows grimacing and reluctance to move, so the nurse explains the benefits of taking pain medication. So here we're talking about non-maleficence. So the best answer is letter A. Letter D is eliminated because when you are talking about explanation, by explaining the benefits of pain medication, the nurse is applying the principles of beneficence to help the client recognize the balance between pain, control, and also by safety. And when you are talking about goals of management. That is basically talking about autonomy. And of course, if you're talking about for letter B, advocates for pain medicine, then that specific because that's not a specific principle of ethics. So number 12, the best answer is letter A because that is to prevent harm. And of course, if the client is successfully sedated, the nurse knows that giving additional opioid medication could do more harm than good to the client. So the nurse would conduct further assessments and seek alternative options for pain relief. 12 is letter A. Let's proceed now to the other aspect, and that is for care of adult clients undergoing surgery. 25. The nurse requests the client to sign a surgical information for emergency appendectomy, which statement by the client indicates further teaching is needed. We're looking for a wrong answer here. Letter A, I will be glad when this is over, so I can go home today. Letter B, I will not be able to drink anything prior to my surgery. Letter C, I can practice relaxing by listening to my favorite music. Letter D, I will need to get up and walk as soon as possible. Of course, eliminate natin yung letter B, C, D because these are considered to be correct. The client should be on NPO prior to surgery that is prevent the aspiration during the anesthesia. And of course, the client here shows understanding. Listening to music is basically to relieve anxiety and encouraging the patient to get out of bed and as soon as possible. The recovery is actually going to prevent also thrombophlebitis. The best answer is letter A. I will be glad when this is over so I can go home. So the patient should be for hospital stay, for hospitalization for a few days. Then this is not a uh, this is not a day surgery procedure. Therefore, the client needs to request for this. The client needs to have further teaching. 25 is letter A. 26. The nurse in the older area of their surgery department is interviewing a client who requests to keep his religious medal on surgery. Which intervention should the nurse implement? A. Notify the surgeon about the client's request to wear the medal, tape the medal so to the client and allow the client to wear the medal. Letter C, request the family member take the medal prior to surgery. Or letter D, explain taking the medal to surgery is against the policy. Of course, here you're talking about being an advocate. Letter A is wrong because the surgeon does not need to be notified of the client's request. This can be addressed by the nursing staff. Letter D is wrong because the hospital policy should be established for the well-being of clients and spiritual needs should be addressed. And letter C is also wrong because the client should be allowed to bring the medal to surgery if the medal is taped to the client. So the best answer is letter B. The medal should be taped and the client should be allowed to wear the medal because meeting spiritual needs is essential to this client's care. 26B. 27. The nurse must obtain surgical consent forms for the scheduled surgery, which client would not be able to consent legally for surgery. 65-year-old client who cannot read or write, 30-year-old client who does not understand English, 16-year-old client who has a fractured ankle, or 80-year-old client who is not oriented to the day. Of course, we know that 65-year-old client who actually cannot read or write can place a mark or an X mark on the form and are legally able to sign a surgical permit as long as the client understands the benefits and including the alternatives and all potential complications of surgery. If the client does not speak English, can have information given and questions answered in the client's native language, so there will have to be a need for possible translation. Then letter D, if the client is able to give permission unless determined incompetent, so not knowing the day of the week is not significant. So that is basically eliminated. Answer here is letter C, because 16-year-old is not legally able to give permission for possible surgery unless the adolescent has been given an emancipated status by a judge. So this information was not given in the STEM. Therefore, the correct answer is letter C. Next, 28. The nurse is preparing a plan for surgery. Which intervention should the nurse implement first? First, of course, that is, check the permits for the spouse's signature. Letter B, the take and document intake and output. Letter C, administer the on-call sedative. Or letter D, complete a preoperative checklist. Of course, we know that you are preparing the client for surgery. Therefore, you need to make sure that there has to be a complete checklist. So, client should never be sedated until the permit has been verified and all legal issues are settled. So, letter D is the best answer. So, letter A is wrong because that should have to be the client, not the spouse. And letter B is also wrong because uh, it's not a first intervention. Only if there is an abnormality. And letter C is wrong because sedative should be administered after after the surgical checklist has been completed. 28 is letter D. That should be letter D. Okay, typo error. That should be letter D. 29. Which activities are the circulating nurse's responsibility in the operating room? Monitor the client. Well, monitor the position of the clients, prepare the surgical site, and ensure the client's safety. Letter B, give preoperative medication in the holding area, and monitor the client's response to anesthesia. Letter C, prepare suture, set up the sterile field, and count all needles, sponges, and instrument. Letter D, prepare the medication to be administered by the anesthesiologist and change the tubing for the anesthesia machine. Of course, kailangan pa ba memorize yan? The answer is letter A. Circulating nurse is basically responsible uh, on coordinating the activities in the OR, keeping the OR clean, ensuring the safety of the client, and maintaining the humidity, lighting, and safety of the equipment. BCD is the responsibility of the surgical team, because we know that letter B is for the anesthesiologist or a nurse anesthetist. Letter C is for scrub nurse. Then, of course, we know that letter D is specific for anesthesia technologies. Therefore, 29 is letter A. 30. The circulating nurse observes the surgical scrub technician remove a sponge from the edge of the sterile field with a clamp and place a sponge and clamp in a designated area. Which action should the nurse implement? Place a sponge back where it was. Do nothing because this is the correct procedure. Letter B, tell the technician not to waste supplies. Letter D, take the sponge out of the room immediately. Eliminate letter D immediately because that's a absolute term. So taking the contaminated sponge out of the room would cause a discrepancy in the sponge count. And letter A is uh, wrong because that could contaminate the sterile field. Letter B is also wrong because the technician is following principles of sepsis. The answer here is letter C. Do nothing because the procedure is correct. Sponges are counted to maintain safety, so all sponges must be in the vicinity. The sponge must be removed, not used, and placed in a designated area to be counted later. 30 is letter C. 31. The circulating nurse and scrub technician find a discrepancy in the sponge count. Which action should the circulating nurse take first? Notify the client surgeon, complete an occurrence report, contact the surgical manager, or recount all sponges. Best answer for 31 is letter D. You recount the sponges that may lead to discovery of the cause of the presumed error. Usually, it is just a miscount or a result of a sponge being placed in a location other than the sterile field, such as the floor or the lower shelves. Answer here is letter D. Letter A is wrong because it has to be recounted before reporting it. Then, if an error is found to have been made, an occurrence report will be completed after the counting is done. Then, letter C, that will be done if the correct count is not maintained, but that is not the first intervention. 31 is letter D. 32. Which violation of the surgical sepsis would require immediate intervention by the circulating nurse? Surgical supplies were cleaned and sterilized prior to the case. Circulating nurse is wearing a long sleeved sterile gown. Letter C, masks covering the mouth and nose are being worn by surgical team. Letter D, the scrub nurse is setting up the sterile field, is wearing artificial nails. Of course, lampa by Mavaresian. That's letter D, because according to CDC and at the same time, our ORNAP in the Philippines and other members of other association of operating room nurses and of course infection control, artificial nails harbor microorganisms which increase the risk of infection. So the answer is letter D. ABC are considered to be not a violation. 32 is letter D. 33. The PACO nurse is reviewing the client from the OR. Which intervention should the nurse implement first? A. Assess the client's airway. B. Apply oxygen. Letter C. Take the client's blood pressure. Letter D. Monitor the pulse oximeter. Of course, letter A, C, D are part of the assessment. Letter B is actually eliminated because that is an intervention. But here we talk about uh, ABC. That's airway, breathing, circulation. So we check for airway first. So the airway should be assessed first when caring for a client. Then I should follow the ABCs, and that is 33, letter A. 34. Which assessment data indicate the post-operative client who had spinal anesthesia is suffering a complication of the anesthesia? A. Loss of sensation at the lumbar uh, dermatome, abscess of the client's posterior tibial pulse. The client has respiratory rate of 8. The blood pressure is within 20% of the client's baseline. Complication, that is spinal anesthesia. Letter D, that is considered to be an expected outcome and does not need or does not indicate possible complication. Letter A, that's also expected because that's spinal anesthesia. And letter B is also an indicative of possible block in the blood supply, but that is not a complication of spinal anesthesia. The best answer for 34 is letter C because we know that spinal anesthesia move up rather than down the spinal cord. Therefore, respirations can be depressed and possibly even block. So that needs to be checked. Answer for number 34, letter C. 35. The surgical compliance vital signs are temperature of 98, pulse of 106, respiration of 24, and BP of 8840. The client is awake and oriented times 3, and the skin is pale and damp. Which intervention should the nurse implement first? First, call the surgeon and report the vital signs. Start an IV of defibrillator R with 20 equivalent KCl 25 ml per hour. Elevate the feet and lower the head. Monitor the advanced sensitivity 15 minutes. Of course, in this case, you are suspecting that there is hemorrhage or hypovolemic shock. Therefore, you increase the venous return. The best answer for number 35 is letter C. So that's basically on making sure that you are increasing the volume of blood returning to the body for perfusion. And when signs and symptoms of shock are observed, the nurse will monitor vital signs more frequently than every 15 minutes. And starting it with an IV, uh, that should be good, but should not include potassium. And of course, you are going to notify the surgeon if assessments has been done properly. Answer here is letter C. 36. The PACO nurse administers narcan-napid antagonists to postoperative client. Which client problem should the nurse include to the plan of care based on this medication? Of course, we know that uh, opioid is basically going to cause respiratory depression. Therefore, our focus is about respiration. So the answer for 36 is letter B. That's not for comfort. That's not also for infection and also for fluid and electrolytes. But the focus here is basically on respiratory pattern. So that can be treated and checked if there has to be improvement of this Narcan administered. 36 is letter B. 37. Which data indicate to the nurse that the client who is 1 day postoperative right total hip replacement is progressing as suspected? Urine output of 160 ml in the past 8 hours, it should be 320. 8 hours times 30 is to 40, that's so kulang. Paralysis and paresthesia, that's also not good. And your vital signs is also not normal. So the answer here is letter D, because that indicates that there's an adequate gas exchange that actually prevents postoperative complications and indicates that there is an effective nursing care. So that is letter D. So that is it. Thank you so much, everyone. See you again next time. Bye.